And self-harm among young people is also a significant public health concern. In the UK, where our study was based, self-harm among adolescent girls has increased sharply in recent years. So we wanted to study an issue that was of immediate public health relevance.
That's Dr. Leah Richmond-Rakerd from Duke University and the University of North Carolina, who will be talking with us about her research on young people who self-harm and go on to commit violent crime. Her work appears in the March 2019 issue of the American Journal of Psychiatry. I'm Michael Roy, Executive Editor of the American Journal of Psychiatry, and this is AJP Audio. Dr. Leah Richmond-Rakerd is the lead author of an article in our March issue entitled Adolescents Who Self-Harm and Commit Violent Crime, Testing Early Life Predictors of Dual Harm in a Longitudinal Cohort Study. Dr. Richmond-Rakerd is a postdoctoral fellow in the Department of Psychology and Neuroscience at Duke University and the Center for Developmental Science at the University of North Carolina at Chapel Hill. Her research aims to identify the mechanisms that underlie difficulties with self-regulation. In particular, she tries to understand how genetics and the environment affect the course of mental health problems and other problematic behaviors, including self-harm and suicide. Dr. Richmond-Rakerd, hello and welcome to the podcast.
It's great to be here. Thank you so much for having me.
You bet. Now, your article explored the shared and unique risk factors of adolescents who self-harm and of those who harm themselves and others. Now, it used data from a nationally representative cohort of twins born in the United Kingdom. Now, first, could you talk about why you and your co-authors decided to study this issue?
Yes, I'd be happy to. We chose to study this issue for a few different reasons. We found that the association between self-harm and violent crime had largely been studied in forensic samples, and providers in forensic settings seem to be well aware that the behaviors go together. But this seemed to be less well known among providers in mental health settings, who may encounter young self-harmers in emergency rooms or other clinical settings. So we really wanted to reach those providers with our study. We also felt that there were several features of our sample that made it an ideal one in which to study this issue. So we assessed self-harm and violent crime across adolescence and into the start of young adulthood, which is when self-harm emerges and criminal offending is most prevalent. We also had a prospective design, which allowed us to measure childhood risk factors before the onset of self-harm and offending. Our cohort was made up of twins, which allowed us to test whether self-harm and violent crime go together solely because they come from the same genetic or family risk factors. And our study incorporated really detailed assessments of the twins' self-harm behaviors, their mental health, and their life characteristics, which allowed us to draw a pretty comprehensive picture of their functioning in different areas. And self-harm among young people is also a significant public health concern. In the UK, where our study was based, self-harm among adolescent girls has increased sharply in recent years. So we wanted to study an issue that was of immediate public health relevance.
Indeed, and your study uses the term dual harmers to describe young people who engage in both self-harm and violent crime. So what features are unique to this group, the dual harmers, compared with young people who self-harm only?
We found that in childhood, dual harmers had poorer self-control than young people who only self-harm. They had more difficulty regulating their emotions and controlling their impulses. These self-regulation problems were reported by different informants, including parents and teachers, which suggests that low self-control is a pretty salient early risk factor that's evident across different settings. Dual harmers were also more likely to have experienced childhood maltreatment. In adolescence, dual harmers differed from self-only harmers in several different ways. We found that they were more likely to experience comorbid mental health problems, including psychotic symptoms and substance dependence. They were also more likely to experience multiple types of adolescent victimization, what we've termed polyvictimization. And they were more likely to have been the victim of crime, maltreatment, neglect, and family violence. So this indicates that dual harmers are not only at elevated risk for maltreatment in childhood, but are also more likely to be re-victimized in adolescence. We found that dual harmers' personality features, which we measured using the 5-factor model, also differed from those of self-only harmers. So dual harmers were more resistant to change, they had poor impulse control, and they also engaged in more aggressive and rude behavior. And their personalities were characterized by 3 different features that underlie emotional and interpersonal dysregulation. So those were low agreeableness, low conscientiousness, and high neuroticism. This suggests that their self-regulation difficulties continue beyond childhood. And I think it's also important to note one area in which dual harmers did not differ from self-only harmers. We evaluated participants' use of support services in the prior year, including mental health professionals, medication, and other types of services such as medical doctors or social services. And we found that although dual harmers had more mental health difficulties and were more likely to be victimized in adolescence, they were not more likely than self-only harmers to encounter any of those support services. So I think that's pretty concerning, and it suggests that dual harmers might face additional barriers to treatment beyond those that we're already familiar with, like long waiting lists or high thresholds to access treatment. Mistrust of authorities might play a role, particularly if dual harmers have already had encounters with the juvenile justice system.
I think what we most appreciated about your study is how it kind of recommended a treatment-oriented rather than a punishment-oriented approach directed toward the dual harming adolescents. What other aspects of your study would you say are relevant for researchers, clinicians, and other mental health professionals?
Yeah, so our findings suggest that researchers who study self-harm, even if they use community samples, so not only clinical or forensic samples, should also assess interpersonal violence. We also found that genetics in the family environment could not fully explain the association between self-harm and violent crime, which suggests that other important factors might also mediate the association. Theoretical models of self-harm can guide future research to test those mediators, and I think that self-regulation is a strong candidate. Many theories of self-harm propose that it serves an emotion regulation function, and it's possible that self-harming adolescents might also engage in other harmful behaviors, such as violent offending, to derive those same benefits. I should emphasize that our study didn't directly test that question, but our results do support further research on self-regulation as a potential mechanism that underlies the association between self-harm and violent crime. We also hope that our study encourages researchers in different areas to collaborate more with each other in work on dual harm behavior. So to date, it seems that self-harm and violent crime have largely been studied separately within the mental health and criminology fields. And I think we can really foster more effective preventions and treatments by working together across different disciplines. Several implications of our study are relevant for clinicians and other mental health professionals. Clinical guidelines recommend that providers assess risk for suicide among individuals who self-harm, and our findings suggest that those providers should also assess self-harmers' risk for violence against others, especially if they present with relevant risk factors and correlates. Also, interventions that are designed to improve self-control among self-harmers might help reduce risk for violent offending. Self-control training has shown promise in reducing delinquent behavior and could be delivered to adolescents who self-harm. And our results also suggest that interventions really need to target dual harmers' mental health broadly. Transdiagnostic interventions that target self-regulation could be one approach to help reduce harmful behaviors and co-occurring mental health difficulties. So mindfulness-based approaches for emotion regulation are one example. And our findings also point to the importance of delivering both primary interventions to prevent childhood maltreatment, as well as secondary interventions to prevent re-victimization as individuals grow older. And more generally, as you mentioned before, we really hope that the results from our study inspire compassion among providers who work with dual harming adolescents. Our findings that indicate that dual harmers have experienced violence from a very young age. So as you said, we really recommend that a compassionate and treatment-oriented approach rather than a punishment-oriented approach is what's needed to meet these young people's needs.
Well, I think that's in the offing because your paper definitely got a lot of attention back earlier this year when we published it online. And so I think it's because of the encouraging leads that your study findings have shown. So what's next for you in your research?
Yeah, so my primary area of interest is self-regulation, and I try to study it using as many different methods as I can. One line of my research is focused on integrating novel genomic discoveries into prospective studies of health and development to evaluate how genetic risk and social environments combine to influence the course of mental health problems. For instance, my colleagues and I are testing how genetic risk for poor self-regulation, as measured by a genome-wide polygenic score, predicts the developmental course of disinhibitory problems, including antisocial behavior and substance misuse. Another line of research is focused on testing how early self-control problems predict individuals' physical, mental, and their financial health as they grow older. I'm also starting to work with data from population-based administrative registers that are linked at the individual level. And these registers provide what I think is a really exciting opportunity to study self-regulation outcomes at a nationwide scale. Currently, my colleagues and I are working on a project focused on health and social inequalities, but I'm also interested in using these data to study self-harm, antisocial behavior, and other health risk behaviors. These registries provide data that have been collected at the individual level over time, which can allow us to investigate the developmental course of different problems. They also record information about behaviors that are rare and that may be more difficult to study in smaller scale cohorts, such as suicide. So that's a general overview of the different types of methods I'm using to address questions about self-regulation across the life course.
Well, we definitely look forward to seeing the results of this work. Dr. Leah Richmond-Rakerd, lead author of the lead article in our March issue. Thank you again for joining us.
And thank you so much for having me. I really enjoyed it.
That concludes this episode of AJP Audio. You can rate and review the podcast on iTunes, Stitcher, or wherever you listen to it. Please also visit our website, ajp.psychiatryonline.org, to check out trending articles, find CME courses, and watch videos highlighting some of our other articles. Be sure to check out another podcast from APA Publishing. From Pages to Practice reviews the latest research published in the journal Psychiatric Services. It's hosted by Dr. Lisa Dixon, editor-in-chief of the journal, along with Dr. Josh Beresin. You can find it at ps.psychiatryonline.org. You can also find it on Apple Podcasts or on the podcast page of the American Psychiatric Association's website. Next month in the podcast, we'll talk with Lori Zellner of the University of Washington about her article on whether a patient's preference for a certain kind of treatment can affect treatment outcomes in PTSD. We hope you'll join us. Thank you for listening.